Good evening. Good evening, everyone. It is Tuesday. It's Tuesday, and we are live for another absolutely fabulous conversation. Um, I'm just so fortunate to meet the most wonderful people that want to share their lives with us. And so I just want let me introduce myself first. I'm going to tell you why I am smiling from ear to ear in just a second. I can't tell you. I don't know when this smile is going to go away. Right? It's going to be here for a minute. But hello, everyone. Good evening. I am Atanya Jean Funny, your audacious advocate, and I use my love for learning and passion for community engagement to empower families. And I must say, I am also a candidate running for county commissioner, Clayton County, District 3, yay, 2024. So now, let me tell you a couple things. First of all, this week is the week for qualifying for municipal races. So, people that are interested in running for mayor, if they are interested in running for city council, they have to live within the city limits to be able to run for those positions. But qualifying is this week. So I've already seen some signs out. So if you live inside of the city limits, you'll see signs up. That election is in November of 2023. Okay. November 2023. We don't want to confuse you. But qualifying for municipal elections is this week. All right. Now, I told you I'd tell you in just a second why I am smiling from ear to ear today. And that is because my student loans were forgiven. Hallelujah. Glory be to God. Um, I just want to let people know, right, that sometimes when you have a debt, it seems like such a burden. And you always feel like at some point you will be able to pay that debt off or, you know, handle it. And I must be honest with you, for many of us, student loan debt was one of those debts that we really didn't feel like we would ever. Oh, congratulations. Me too. Gaston, congratulations. But we really didn't feel like we would ever pay it off. I honestly thought I went into education, I got the debt for education. Okay. We all know teacher salaries are not on the higher end compared to the amount of education that we have to become a teacher. But I really felt that I was going to pay the mortgage on my house off and still have student loan debt. I honestly felt that 15-year, 20-year mortgage, 30-year mortgage, I felt like it was achievable to pay off my house, but I was still going to retire from the career that I took out the student loan debt for and still have that debt over our heads. And so and as some of you all may or may not know, I was a science teacher, which means that I went into a critical shortage area and they told us that we were eligible for loan forgiveness after those 10 years of paying faithfully. And then when you call and they say, nope, we don't have any money in the program we didn't fund it. We passed the bill, but we didn't fund it, right? So for those that may be saying, oh, I paid off my debt, they could have paid theirs off, please understand that we did our part according to what the federal government told us we were to do. And 20 years later, we were still paying on a debt and didn't see any relief. So I know I put on one of my posts earlier, in my house, we will pray and we will also vote, because I'm sorry, the other administration was not going to relieve us of student loan debt. So, hey, that's where I am. So, yes, this smile on my face, glory be to God. for putting it in the heart of Biden to help us finally be able to see the horizon and get from under that burdensome student loan debt. So that's my little 2 cents for today. I'm going to get off my soapbox now. So today, yes, she said 10 years. She was told the same thing as a nurse, 10 years. All right. So today I have the absolute pleasure of introducing my guest, who is, I feel like a kindred spirit. We haven't known each other that long, but there's a connection there. Dr. Gabrielle Williams, who, you know what? I'm going to let her tell her story. Okay. So I would like to bring her on now.
Hi.
Hello. So take a couple minutes and introduce yourself to everyone. I'm going to give you the spotlight, okay?
Sure, no problem. Hi, everyone. I'm Dr. Gabrielle Williams. I am a product of Clayton County Public Schools. And I'm a primary care doctor in the area. And I am so excited to be on here to talk with Atanya Jean Funny about my experience of becoming a doctor, in hopes to encourage others to pursue it if you're interested, to know that it's possible, that it's not out of reach to become a doctor.
Yes, absolutely. We're going to have a great conversation this evening. So what what I want to first emphasize, you was raised in Clayton County.
Sure was.
Tell us about that. What schools did you attend?
Of course, yeah. So originally I'm from Miami, Florida, and I was born to Haitian immigrant parents, IET, and we moved to Georgia while I was in elementary school. So I attended Mount Zion Elementary, and then went to MD Roberts off of Walt Stevens Road in Jonesboro, and then graduated from Mount Zion High School.
All right, look at that, Clayton's own, as we like to say, which is absolutely amazing. How was your experience growing up? Now, you know, we both grew up in Haitian households, so I'm going to say that you are every Haitian parent's dream. You know, doctor. Well, I guess immigrant also. Doctor, lawyer, engineer, maybe teacher is in there.
Right. Right. Listen. So yes, I know my Caribbean people can understand. My Africans, again, all immigrants. That, of course, the parents come to the U.S. to get their children a better life than what they had, and you know what they instilled: education, and some more education. Right.
Absolutely.
So my parents, they didn't necessarily push being a doctor, but when they found out that I was interested, of course, they were really proud and happy for that. So they instilled education. So we didn't watch TV during the week. There was no such thing.
Wow.
There's a such thing as doing your homework.
Yes.
There's a such thing as going to school every day, no matter how you feel, you know. So for better or for worse, here I am, right? So we definitely were big on education.
So let me ask you a quick question, because you have children.
Yes.
Is that something that you are going to stress with your kids? Because I know your kids are a little younger than mine.
Yes. So I have a 6-year-old girl and a 4-year-old boy. And I'm definitely going to take some of what my parents said about like not being distracted by television during the week and focusing on doing homework. But my stance might not be just be a doctor, engineer, or lawyer, but be successful in what you do. Okay. Even entrepreneurship, small business owners. Right. So, but I'm with them on education, because truly, you know, I feel like the best ways to move in this world is if you understand what's going on, if you're able to read, write, and to understand conversation and grow your knowledge to learn more. You have to be able to learn and get educated on what you want to learn about. So I grew up with 2 other siblings, a younger brother, younger sister. So I'm also the eldest.
Me too. I told you, I knew we had kindred spirits. Go ahead.
Right. So the pressure as the eldest.
Different type of pressure. There is, oh goodness, there's nothing like being the oldest.
Right, exactly. So I'm really, really, really proud of my parents. My mom worked 2 jobs. My mom was a CNA and worked in the schools as a lunch lady. And then my dad was a taxi driver. Again, typical Haitian immigrant. Those were the occupations that a lot of them did. And I'm just so grateful that even though they had their own education limits, they were able to push us to go for what we wanted to do, especially as being a doctor. So I decided to become a doctor in high school, and I did not write this on my application, but I was inspired by the show House.
Wow.
TV
Okay.
show House. I think it came before or after American
I remember
Idol.
it.
Yes, yeah, that was my show because I love the ability to solve mysteries, but it's in someone's best interest, right? So not just solving a mystery just to solve it, which is a good thing too, but it was used to help someone else, and so I was inspired by that. But I was like, maybe not. Let me be a mathematician. I love math. I'll be an accountant. Maybe I'll be a counselor. But when I look back and see like the aspects of counseling I enjoyed was getting to know people, talking with them, listening. I'm nosy. Okay. I ask those deep questions to try to figure out what's going on and to help people. But also with mathematics and accounting and science, I enjoy those things. And so I can see how being a physician allows my love for one thing to help with my love for something else, which are people. So I decided to go into medicine and went to the University of Georgia. Go Bulldogs! Went to the University of Georgia and did my bachelor in microbiology. And let's just say there's not a lot of jobs available with doing a biology microbiology degree, but glory to be God, I landed a job at Southern Regional because I took a year break from before going into med school. And at Southern Regional, again, Clayton County, I was able to learn the other side of healthcare, not just treating patients, but what goes on the financial side, prior authorizations, working with insurance, trying to figure out what can be covered. I specifically worked with the cancer patients. So what chemotherapy is covered by the insurance, what is not, what's the alternative. So I was able to learn the backside or the back office of medicine. And so then I then went to the Medical College of Georgia, the Athens campus for medical school. So I stayed in Athens another 4 years.
Okay.
So I was able to do that for 4 years. Oh, I forgot one thing. I did do dual enrollment at Clayton State University while in high school. I forgot to mention that.
And that is a very robust program through our school system. When I was teaching at North Clayton High School, we had several students to participate in dual enrollment. I think in Clayton County, I know it's all over, but we're very proud because I know, like when I was in school, you were able to take a couple classes, but now students are literally graduating with their AA degree before, because it's like a month before they graduate with their high school diploma.
Right.
So I think it's absolutely phenomenal. I'm a little disappointed in our state house because they said, oh, the program is too expensive now. So
please
no, for real. So now they passed the bill because I know some of our students started taking dual enrollment classes like in ninth grade.
Oh, wow.
So they passed a bill now that it's more so for 11th and 12th graders. So I don't know how, if they want to take more classes, now the parents have to pay. So it's a certain number of credits, because all of a sudden it became too expensive, but we have this huge surplus on the state level. But that is one of my stance when I say everything is political. So But so you took classes. So while you were at Mount Zion High School, you entered into dual enrollment with Clayton State. So you came
Yes.
out, you graduated from high school with college credit.
Yes. So I was able to
Mhm.
graduate college a semester early. So that was helpful. So yeah, so again, just like showing how Clayton County is weaved into my story and my
Yes,
journey. Um,
absolutely.
yeah, and I don't know if anyone's going to hear this, but please keep dual enrollment, keep the program robust, because here's a
Yeah.
product of someone who has done it, who's benefited from it, and can now give back.
Yeah, absolutely. Absolutely. So tell me about medical school. How was that?
Ooh. Oh, those were some long days, long days, long days. So, I mean, in the books all the time. So,
Mhm.
thanks to my parents, I wasn't missing TV during the week, like before, because I was used to not being able to watch it. So, I'm used to being disciplined and knowing that during the week it's schoolwork. But that was a interesting experience. The program was predominantly white, and
Yeah.
so that had its own I guess biases. We'll call it that. Yeah, biases within the program. There was even comments that they didn't. A student didn't like how what is it called, where they allowed students in based on their race
Oh,
and
affirmative action?
affirmative action, trying to make the point that that's how some of the Black students got in, and so that was hard um, to stay in because I felt like I wasn't being heard or seen.
Mhm.
But I did, forge good relationships with some of the students and got along with most people. So it was fine. It's just you can see what people think about you. Not everyone, not
Yeah.
saying that's everyone, but you can see just based off of your color of your skin what people think of you.
So it's
Um,
almost like another layer, like going to medical school already has the stress and the amount of work and
right,
just the tension that goes with it and the responsibilities that go with it. But as an African American in that environment, you have another layer of basically saying, I have to prove myself,
right,
prove that I belong in this
right,
seat, that I didn't take this seat from
right,
someone else that is like more deserving.
right,
So it's like some of the things that people that are not in our shoes have to understand, like you can never be in our shoes, but please know we earn everything that we get.
sure did. Because we have another layer of imposter syndrome. So we're well, I did anyway, constantly trying to prove, constantly going above and beyond, right?
Mhm.
And that's what parents taught me too. Go above and beyond, do your best, and make sure your best is the best.
2,
so
3
so
times better.
correct. So, always
Mhm.
having to do that and not feeling like you are enough, that you did enough, but just constantly,
Mhm.
okay, I just have to do more, do more. So, yeah, so that was just a little part of my experience. Not saying that it's all, but yes, it was heavy on the books, heavy on learning different specialties within medicine. So initially I was interested in being an OBGYN, so obstetric gynecologist, to deliver babies and women's health, all for it.
Mhm.
Until one day during the clinic, I was shadowing one of the doctors, and the patient asks, "Oh, I think I have pneumonia because I have a cough. Can you prescribe me medicine?" And the doctor said, "Oh, I don't do that. You're gonna have to see your primary care doctor." No
Oh,
shade to
wow.
anyone, no shade to anyone, because I understand that that's not their area of expertise. But I was like, I want to be able to do more than just, okay, I'm going to refer you to someone. I want to be able to at least start the front line, initial workup or initial treatment. And of course, if things don't work out or we need specialty, um, their expertise, then yes, of course. So I was like, no, I want to be able to do more or not have to be so super specialized. And so I went to a different clinic with family practice and family medicine. And I was like, this is it. There is variety every
You
day.
found your passion.
I found it, right. There's variety every day, like in the next, between patients. You're not seeing the same condition all the time. You know, you know enough about everything, but you don't know depth, right? So I have a good foundation knowledge of a lot of conditions, but I don't have depth as far as if it were to get more complicated or severe, that's where specialists come in. And I struggled with that. I was like, oh no, I have to know everything. That kind of thing in me, type A, whatever you want to call it. It's like I gotta
Yeah.
know everything. I gotta be able to treat everything. And but I've settled on, the ability to know enough about a lot of things, like that's still helpful and brings value to patient care.
Yeah.
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 So
That's
yes,
awesome.
yeah. So then I had my daughter at the end of med school, and
So you were pregnant while in med school.
I got married right before med school. Then I had
Wow.
a baby in med school,
Wow. Now I
and
know when
then
I was pregnant, that
uh,
morning sickness, which they don't tell you is not just in the morning. I never ate so much ginger candy in all my life. A
right,
Filipino, one of my Filipino coworkers was like, because I was like, oh my gosh, I feel horrible. And she brought me this ginger candy and I ate bags and bags and bags of it. How? How did you get through medical school pregnant?
man, God is good. I had some morning sickness, but it wasn't too bad, and I don't know. Maybe I'm just really like work oriented and accomplishment oriented. I just kept going, and
Yeah.
and I thank God that there were no complications. Like
Hmm.
I thank God that no complications, because that could have been a different story, to
Yeah.
tell.
Yeah.
Um, so
And I
yeah,
think
so then
so yeah, as you say that, I'm thinking about our healthcare, right? And the disparities that we have as Black women with our healthcare. And some of it has been the biases has been embedded within the system of medical care, healthcare. And one of the things that I was reading at one time is that they don't take a lot of times when you go in the hospital, they don't take Black women. I don't know if it's not as serious
Mhm.
because it is a myth that we have what a higher tolerance for pain or just different things that they don't have. They don't seem to always have the urgency as they do, which is causing to have our higher mortality rates. Like, so can you speak a little bit about that?
Oh, sure, yes, yeah. There is implicit bias anywhere, everywhere, with everyone. Unfortunately, because
Hmm.
we are programmed based on our upbringing, based on what's on the news, the TV. And so, if our agenda, or if the agenda that's pushed that Black people are poor, uneducated, abuse the healthcare system, drug seeking, always wanting pain medication. If we're continuing to press to push that agenda, more people are going to believe it, because that's what the perception of reality that we are giving them as a country, right? And so there's a lot of implicit bias, but we talk about that a lot in med school to work through that, so that we can come at patients with less bias and kind of open without
So you're saying
prejudice.
that it's being addressed more maybe than it was for people in medical school years ago.
Right. Yeah, I'm not sure how it was back then, but I know for sure in my upbringing, implicit bias was its own course, like its own class. Like
Okay,
that's
okay.
constantly discussed to make sure that we address it. Even in residency, which is training for physicians, for doctors, implicit bias for sure. Yeah, and how to address it, or yes, how to confront it, and then how to address it.
That is good to know because this is definitely something as a nation that we need to discuss because the numbers and now we need to continue to talk about all of these different factors.
Mhm.
That's why when we see that in our education system and in the curriculum, so
Right.
many things like, no, we don't want to talk about that. We don't want to hurt anybody's feelings. No, we don't want to talk about, certain things, but
Mhm.
these things need to be discussed as a nation, because our numbers, for being so highly developed as a nation, our numbers are not looking good.
Right.
When we talk about healthcare access, um, and just disparities within communities.
Right.
So I'm glad to hear that in your studies, and hopefully as others of color go to medical
Mhm.
school, we'll see that. Were there any programs to help you to like pay for medical school? Did you know of any programs that were like geared to African Americans and things like that? Or was there something in high school, or do you think what type of things would be needed in our school system to steer more students toward the medical field?
Right. So yes, there I went to, or since I stayed in Georgia, there were grants available.
Mhm.
So that I got grants for undergraduate and also for medical school. And through the school system, they have scholarships for people of color to help, I guess, decrease the burden of financial burden.
How did you find them?
Oh, those were offered automatically, which is really
Okay.
great. Yes, so they were offered automatically.
So
Now
what
to
once you were accepted into medical school?
correct, yes.
Okay, okay.
Yes. Now, to help fund for medical school, I didn't do this program at the time. Now, I wish I did, but there's the National Health Service Corps. When you apply for it during your undergrad and you know that you want to go into primary care and you want to go to medical school, like that's the field that you want to go into, you can apply for that, and it's a federal program, and they pay for medical school if you and you are obligated to fulfill a requirement, which is working in an underserved area for 3 to 4 years, and then your whole debts are you don't have any debt because they paid for med school, and they also provide a stipend. So that's National Health Service Corps. There's also the military program. So depending on which branch of the military, they can help cover your medical school expenses plus a stipend, and your obligation is to work in their in whichever branch for a number of years.
So I have a question here. Gaston wanted to know, are there programs for older adults? Do you know? Or it's like if you get into medical school, like it doesn't matter your age?
Oh, listen, I know someone who was a lawyer and went into medical school in his 40s. So
Oh
there is
wow.
no age maximum or something. Yeah, there's no age maximum. Of course, they want your credits and your education to be recent in order to get in. However, yeah, there are no barriers that I know of based off of age. Now, if
Okay.
there are, sorry, healthcare scholarships or grants based off age, I'm sure there are. I don't know that. Don't
Okay.
know what they are or the name.
And like I was saying, I like for this to be a learning experience and bring value to the community. What what are the focuses you think that say like an eighth, ninth grader that may be thinking about medical school? What would you tell them if they say, we have a lot, I was a teacher, middle school, high school,
Mhm.
and we have a lot of students, what do you want to do? I want to be a doctor. I hate math. you know, I want to be a doctor, but I hate science.
Mhm.
um,
Mhm.
so, as someone that has gone through the whole experience, what would you say to them or to their parents to say, your child is interested in this field? This is how you can prepare them to get ready to go into a field like yours.
Yes, exposure is my big um, advice is to is to get exposed to the medical field. So I believe in middle school and high school there was this nursing program that students to go into. No, it's not being a doctor, but at least you're exposed to the healthcare industry.
Hmm.
One, two, shadowing doctors. Shadow as many as you can so you can get an understanding of what it looks like to be one. Also, showing that you're well rounded. You don't have to do every science club that's ever been invented or that's in every in your school find other interests. What is something else that interests you? If it's art, join the art club. If it's music, join a choir. Show that you're well-rounded, because that's what they want to see, that you're well-rounded individual. And I know
Well,
I'll
now
get
we have issues of getting our students to join anything. It's
really.
like, social media,
Oh,
TikTok, just electronics, video games have taken over our kids' lives. So you're saying to parents, hey, parents, they got to put the phone down, and you got to be responsible to make sure that they are a part of either things within the school or finding nonprofit organizations within the community.
right.
Volunteering is a big thing, so they have to have volunteer hours
Yes.
for their college applications and stuff. So
Yes.
you're saying like all of these things are going to be important. I must say that I went to our superintendent, Anthony Smith. We have a new superintendent for Clayton County
Mhm.
schools, and he is promoting a doctors club, and it's going to be for juniors and seniors, so they will be able to be mentored by someone in the profession. But he's opening it up to not just medical doctors, but I guess students that may want to get like PhDs and things like that. But
I
whatever
see.
field you're interested in,
I see.
they're going to be mentors there, and they will be able to shadow doctors in the hospital and things like that. So that
That is
is
how
really
you do it.
good.
Yes, that's how you do it.
So
Yeah.
we got a question in the chat, and I love it because it's just not a conversation between you and me. So I appreciate Gaston for to come in. Anyone else want to ask questions? And this is a big one.
Okay.
Your thoughts on AI in medicine?
Oh, ooh, this is yes. Oh, okay,
I
okay.
know,
Is it
right?
Gaston or? Okay, AI in medicine. So yeah, I have seen so far. It's helpful in note taking, and translation. So doctors are saying that hey, it's helping to cut down on how much we have to type, which takes away time from the patient. And if you have the program in the room, you'll be able to ask your questions, and it's recording what you need. Also, and can also put in orders for the doctors, and also, like I said, translation. So there was a patient that was speaking Portuguese, and the AI program was able to translate what they were saying in English, which is
Mm,
awesome.
nice.
So yeah, I know that we're all a lot of us are apprehensive about AI. I think there was one study that AI tested really high on a medical examination. I'm like, excuse me? But we need the human touch, 1000%. Okay.
Yes,
Now, if they have
yes.
a scanner to look at every disease, okay, maybe I'm out of a job. But just kidding.
Okay.
But no, I think it's with any advancement, it's better to learn with it than to resist it.
To shun it.
And
Hmm.
so yeah, so I'm seeing some doctors are using AI again to be supplemental benefit for the practice and for patient care.
Oh, that's good because I thought you was gonna say stay away from it. So you're like embrace it and use it for the good that,
Right.
and that's like with anything, just
Right.
using it for the good that it will bring because it is not going anywhere.
Right.
Yes.
Right.
Ariel
Exactly.
said hi. Hi, Ariel, two of your
Hi.
Southern Crescent Women in Business members. Yes. Thank you for joining us tonight. That is an absolute awesome question, and I just love your openness. So now one of the things that I hope people will do is check you out on Instagram because you come with the nuggets. You come with the nuggets all the time. So how did that start? And you seem like you really enjoy like bringing those little tidbits.
Yeah. So, like I was saying earlier, like in high school, how I said I love to talk with people, and in med school, I was like, oh, I just don't want to just refer. I want to be able to know enough. And so I chose family medicine. I went to Emory for residency. So that's a 3-year training program for family medicine doctors or primary care doctors. And after that, worked for a hospital employed practice, and learned quickly that there is not enough time to do any of the things that I thought I was going to do as a doctor.
Yes.
And that weighed heavy on me, that I almost decided to quit. I said, anything is
Mm.
better than seeing 20 patients a day, spend 5 minutes with, well, they're waiting in the waiting room for an hour or 30 minutes, then spend 5 minutes with them. And they're, concerned. They're like, man, doctors are just pill pushers. They're not doing anything.
Mhm.
And they're not able to reach me afterwards. And I don't have time to give education. I just have time to give you what you want, which is in a transaction, you're like, I'm here for this symptom. I need you to fix it. And so, patients are not happy if you don't give them something. So, it ends up being a medication. And I'm like, this is not what I wanted. I wanted to educate. That's my big thing. I wanted to educate so that people can become an advocate for themselves. And also, I'm their advocate as well. I want
Mhm.
to build a relationship with them. I want to build trust. There's a lot of distrust with the patients with the doctors because of history, one. And then two, again, just feeling like the doctors aren't spending enough time. They're just here to make money, which I would say for
Yeah.
most doctors, that's
And
not true.
and there and things do happen that are not favorable, and it seems like, when it happens, out of the 100 great things that happen, that
Right.
the one thing that didn't go well is the one that's gonna be highlighted within the community, so that
Right.
adds on to the mistrust.
Right, exactly. And so there, it bred a lot of dissatisfaction and discontentment. And I'm the face of the clinic, right? Like patients only just know me. And so
Mhm.
whatever they're dissatisfied on comes towards me or is directed towards me. And so I was like, all right, well, let's just go find a job flipping burgers and I don't have to do any of this stuff.
Oh, no, parents would not be happy with that.
So exactly.
You might be happy, but they're not
Right.
gonna be happy.
Correct. Exactly. It's like, I know you didn't just spend all those years in schooling to do that. But I was like, I just can't take this on. So my husband saw that I was dissatisfied and said, all right, well, how would you design your practice? And I was like, okay, I would spend this much time with my patients. I would educate them. I would do this and that. And so I wrote it down. And I was like, all right, I don't know what to do with this, but God is good. So he revealed to me a model called direct primary care, where you are the patient's personal doctor. You are spending time with them. You're educating them. We are working on lifestyle to get you, not to just get you better, to keep you healthy. And again, it's not about pushing pills, right? Like
Mhm.
we're getting away with that. We know medications are helpful in certain situations, but there's a lot of diseases that are caused or influenced by our lifestyle habits, good or bad. And diabetes, high blood pressure, the number one killers, heart disease, stroke, those are all affected by our lifestyle habits. And I see in and out the complications of diabetes and high blood pressure, the complications of stroke when you're not able to move one side. You were independent before you came to the hospital, and now
Mhm.
have to use a cane or a walker or a wheelchair, not able to speak, not able to eat, all kinds of complications. And I'm like, this has to stop. Like this doesn't make sense. And I don't think it's fair. And so so now I'm getting, I've been, I guess my passion has been reignited for medicine, because I found
That's
a way
awesome.
to be able to do it well and to do it of course, for the patients, like
Mhm.
to do them a great service and doing primary care the way that they need it and deserve to have it.
Yeah, and you are you speaking the truth. So I think in all the things in my life that I am very happy with, how I've taken care of myself is not one of those things. I think I put myself on the back burner to do everything else and to take care of everyone else. But
Welcome
I'm
to
doing better.
America.
I know, right? I'm doing a lot better. And one of the things that I have started doing is walking on the step machine. So not the elliptical, but the actual step machine.
Hmm.
And I go the slowest level that's there,
Yeah.
but I get it done. And I'm so shocked that I have noticed when I'm walking up and down the stairs in my house has gotten so much easier, by just working those muscles,
Right.
around the knees and the ankles and, those types of things. And I'm just like, oh my gosh, I feel so much better now that I just go in there and grind it and, get my 30 minutes and, started with 15. Now I'm up
Yes,
to 30.
yes,
Woo-hoo.
yes.
So yeah, so the preventive care that you're doing is absolutely fabulous. So something is going down on my son's birthday, September the 18th. So tell us what is happening on September the 18th.
Yes, I'm very excited. Thank you so much for sharing my excitement. I am opening my practice, Gateway Direct Health, where
Woo!
I'm giving primary care the right way to my people.
Yes.
So that again, we are about not just getting you healthy, but keeping you healthy, keeping you off medications as much as possible. Because I know that that's a big concern within the Black community. Is like, all right, we're on all these medicines. Are they helping or are they killing us?
Mm-hmm.
So I'm big on minimizing how many medications patients are on to make sure to give them adequate time. We're doing not 5-minute visits. And I'll tell you that we're doing 60-minute visits, 30, 45-minute visits for patients. We
And
are
that's how you're going to schedule the patients.
Yes, yes,
Mm-hmm.
exactly. We are not, there's no wait time. We are not going to be in a lobby. You're coming straight to the room because we're respecting of your time. I can't tell you how many patients say, well, I have to take the whole day off to go to the doctor. Why?
Yeah.
I'm like, people's time are important. We can't get that back. So we are very mindful of that. And I do provide home visits to those who prefer convenience, who have
You
difficulty with
provide home
transportation.
visits. Home visits? What?
Hi, I'm Dr. Williams of Gateway Direct Health.
Wow.
Yes. Yes, providing home visits. And those who prefer anonymity, they don't want to see everyone to see they're going to the doctor. Sure. I'll come to your home. I'm kind of going back to the way medicine was before. Again, relationship based, quality based, right? Trust based. Not
Mm,
I'm telling my story 3 different times because I see three different doctors. I am one of 25 for the day. I waited an hour and then only spent a few minutes and didn't even get to time to address all my concerns because we didn't have time. Like we're not doing that. We are providing a better healthcare experience. And yes, I'm super excited. And so the social media is an outlet for me to provide those healthy tidbits to educate people's like, hey, hi. There are things that you can do now, like what you said about, first starting off with 15 minutes. That's wonderful because at least you started and
yeah.
see how much you've grown to 30 minutes, right? And then
Mhm.
you see the change because habits are hard to break, hard to form.
Mhm.
So it's going to take time. Medications are a little bit faster, but lifestyle habits are what's going to change the trajectory of your life. Because again, I'm seeing patients who, were just fine and then have a stroke. And I'm sure that that's not what they imagined for how they would look in their 40s. Because some people are having
Yeah.
strokes in even their 30s, or how
Wow.
they want their life to look in their 60s, right? You
Yeah.
work so hard, like my parents, which is another thing. My mom worked, again, 2 jobs for so long, and then a few months after retiring, she had a stroke. And so
Wow.
they didn't get to, or, I'm grateful for her life, God knows. But I'm also like, man, like she spent all this time giving, 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 and
When
then
it was
had a
time for
stroke.
her to sit and enjoy. Mhm.
That's exactly right. So I am big on, okay, let's start living the life that we want now, but we have to prepare for that. We have to do the things in order to live that life. We have to exercise. We have to eat healthy, mindful we're putting our bodies, go to sleep, decrease
Yes.
our stress.
Yes.
Like those are important, not just exercise and eating healthy, decreasing stress, having great social relationships, having fulfilling, healthy, trusting relationships, not just someone taking out of you and then you're not full and you're
Yeah,
empty.
and when you say that about stress, um as a career as a teacher, especially like a secondary teacher, you
Mhm.
have upwards of 120, 130 students and you really want to see all of them succeed,
Right.
every
Right.
single one of them.
Exactly.
And it can be very stressful, so like I was talking to one of our administrators this week, and I was just basically saying that yes, we have to balance the success of the student, but also understand that teachers are human and they want their weekends to spend with their families and to de-escalate. So it's like if you're putting the burden on teachers, like we want all this done and submit this, but make sure that all 130 of your kids do this, and we call them our kids, like we don't even
Right.
call them students, we call them our
Right.
kids. So it's like, as administrators, please understand that the teachers are not robots, they're human, and we're going to have to find a balance, because that's really why one of the main reasons why we have a teacher shortage now, because
Right.
during COVID people realize, you know what, life is short and I need to take care of me. And if that means I have to change my career, I will do that. And I
Right.
need the people that make the decisions to realize we're all dealing with humans here. So when you talk about stress and all that, I completely understand. We do have a question about insurance.
Okay.
With your practice and home visits and all those things,
Yes.
do you take insurance for that? Because I think what the service that you're talking about is what, the movie stars gets.
That is hilarious. Whoa. I hope everyone's happy to know that. No, it's not. This is affordable. We'll call it affordable concierge service, right?
Okay, now.
But to me, I think it should be available to everyone, not just those who are super, super wealthy, right? Which is fine.
Yes.
They deserve, because they worked hard for what they do. But yeah, so I am not billing insurance for the simple fact of how I've seen healthcare based on insurance has looked, and how it's, again, I don't think it's leading to better health outcomes.
Okay.
Because again, like we're primary care is the foundation of healthcare, period. It's the
Mm-hmm.
foundation, and we need a strong primary care system in order to get people healthy. And so I personally will not bill insurance. I will not be paid by insurance. I do encourage everyone having health insurance, because it's helpful for catastrophic events, like if you were to go to the hospital, or you have a big procedure, or you need to see a specialist. It's helpful for those reasons. But for primary care, it's not a great system. I feel like they used primary care as a referral mill, just so that we could refer out to the bigger expenses, and so that the insurance can collect their money. I'm just saying. So I do not bill insurance. So patients pay a monthly membership fee, but again, they are paying for better health care. Because just because you have insurance doesn't mean you have great health care, right?
That's true.
And so it does take an investment in yourself, in your health care, and saying yes to a better way, saying yes to, again, no long wait time, saying yes to lifestyle habits, a care plan that's tailored towards you, your personal doctor who knows you. Again, you're not saying the same story to 5 different people. You're saying it once to your doctor, who is really bent on making sure that she knows her patients, and she's nosy too.
Okay.
That's just letting you
Okay.
know she's nosy. She's trying to figure out what's going on in life, because I know that life is not all about what are your sugars.
Mm-hmm.
Because that's how a lot of the visits are started. Okay, so you have diabetes. Okay, what's your sugar? Okay, good. All right, let's increase your insulin. All right, bye bye. And I don't fault
You
the
say, what's your
doctor.
sugar? That's
Your
the
sugar
question.
level. Yeah,
Oh,
that's
okay.
what we'll say. What's your sugar level? Okay, it's good. It's not good. All right, here's some more insulin. Okay, bye bye. Right, and
Okay.
I don't
Uh-huh.
blame the doctors completely, because again, the healthcare system kind of drives that. So that's is short, and we just refer to more people, or give more medications, right? So it's going to be beyond what's your sugars. It's going to be, how are you? How are the kids? What's going on? What's your stress level? How are you getting your sleep? Like, let's get into the things that do impact your sugars, right? Like, we're going
Okay.
to the root of those things, of those habits that impact your sugar, your blood pressure, your heart disease, all of that.
So your practice is more like almost what we would say like wraparound services.
Wraparound
So
services.
yeah, so like in the education system, we talk about, it's not just about the student and what's happening in the classroom, but it could be the stresses of home and, are the kids able, the parents able to, do they have a roof over their head? So we have what we call wraparound services. There's social emotional services that's needed, psychologists, just
Right.
different things like that. So we call that wraparound services of not just, oh, this student didn't do well on the test, but what are the other factors around, or, student comes in hungry. So that was one of the issues with our school system, is that they was like, the food is not good. So it's like our new superintendent came in. It's like, okay, we're going to a whole new system. I'm hearing much better things about the food now. So just things like that, just making
Right.
sure that the whole person is taken care of.
Correct. Exactly. Because I love the analogy, right? The missed a few questions on a test could just be a symptom and not actually all that there is. Same thing for the sugars. It's a symptom. The high sugars or the high blood pressure is a symptom of something else going on that's deeper, right? That needs more digging, like the mystery of
Mm-hmm.
house. So trying to
Yes.
figure that out. Yes.
Yes. So can you tell people how can they reach you? How can they get in contact with you?
Yes, of course. So my website is gatewaydirecthealth.com, and it explains more about the membership model. And also, you can schedule a free, no obligation meet and greet with me to answer your questions, because I know that this is a newer model to the public. And so I'm more than happy to explain in more detail about the practice. You can also find me on Facebook, Instagram, TikTok at Dr. Not Miss. So that's dr.notms.
Wait, let me put that in. Dr. Dr.
Dot notms.
Uh-huh.
Yes. So yeah, so you'll find the videos on lifestyle explaining the practice more. And the practice has its own Instagram, Gateway Direct Health. And of course, yes, please DM me, message me. Again, you can shoot me an email through the website, and I'm more than happy to explain it and show how much value you get in joining the membership practice. There's a lot of value because we are looking forward to better health and starting now, right? Starting now, so that in our 60s, we're not saying, "Man, I retired and I want to go on vacation, but my arthritis is killing me and I can't do this." And
Yes.
no, we're
Yes.
going on that vacation. We're going to Europe in our
Yes.
60s, and we're going there healthy, and we're gonna
Yes.
be able to keep up with everybody else.
Absolutely. Well, thank you so much for your time. I know we will be spending a lot more time together.
Yes.
I think what you're doing is absolutely phenomenal. And I look forward to being there when you open everything up, and we will definitely stay in touch.
Yes, yes. Thank you again. Thank you. And please help our education system in Clayton County. We can't wait to see what you will do to help.
Absolutely. And thank you, Clayton County's own.
I
All
got you.
right. Have a great night. Oh my gosh, that was such a phenomenal conversation. Thank you, Tanisha. Great conversation. I absolutely love bringing value to our community. This is Clayton County's own. She went to school, elementary, middle, high school, and has gone on to become a fabulous medical doctor. We have it in our community. We have all the resources. And like she said, the biggest thing is having access, having that exposure for our students, letting our parents know this is what's required of them, and having high standards for our little ones. Like mine right now, no electronics during the week. No, you can have them on the weekend because we're in school right now. And so, they get upset for a couple minutes, but they find something else to do, or they read a book, or go to bed on time. So these are just things we need. I want to thank everyone for joining me this evening. As I said, I'm a Tanya Jean Funny, and I am a candidate running for County Commissioner District 3 right here in Clayton County. I would love for you to join me on my group in my group, Community Conversations. Okay, so if you go A Jean Funny, community conversations, join my group. You never know when I might put something in a group that I don't put on anything else now. And also, I want to let you all know that my campaign launch is coming September the 8th. It's on a Friday. I know you need something to do on a Friday. So please go to my page, A Funny for the People, and register to join me for the campaign launch. We're going to have a great time. I want to talk to you. I know you want to meet me. So let's do this together. And we are going to get Clayton County where we want it to be, that vision that we have for Clayton County and the best quality of life. Because as you can see from this evening, there are people doing wonderful things that came right here from Clayton County. So I want to thank you all for joining me this evening. And please go to my group, A Jean Funny Community Conversations. You all have a fabulous night, and I will see you next Wednesday. Good night.